Good morning. I'm Dr. Dangleben, and on behalf of Patient Choice in Chemin, Neuf, Pointe, Michel, this is the medical tidbit of the morning. What do I want to talk about? I want to talk a little more on cirrhosis. I touched on cirrhosis as related to alcohol, etc. But I just want to educate you on the classification that's out there that some of us use to determine what type of cirrhosis, what stage you have, and cirrhosis is the advanced scarring of the liver itself, inside the liver. And that can be caused by any chronic injury. It's really, I would say, an inflammatory response, whether it's alcohol, whether it's a hepatitis infection, or whether it's fatty liver, right? You can get cirrhosis from your liver just being overly fat, all right? Now, the severity, we use a grading system called the Child-Pugh classification. And one might say, well, that belongs with the physicians. But it's always good to educate yourself on what's out there, right? Can't dismiss it, right? And that relies on clinical findings and also laboratory data, all right? So for that classification for your cirrhosis, when the doctor orders the labs, the things that they're looking at are bilirubin, all right? Bilirubin. I'm sure you've seen that on your blood work. It measures your liver ability to clear waste. And if that level is very high, it means that there is some problem with the function of your liver. The next laboratory value is albumin. Albumin is it's a protein that's primarily produced in the liver, right? And it reflects the liver's capacity to produce that protein. All right, so the lower that level, the more advanced your disease. And there is something called the INR, or the prothrombin time, which you'll see on your blood work, which gauges your blood clotting ability. Okay, so if that's prolonged, it should reduce synthetic function. And the liver is responsible for producing all the factors that help you clot. Very, very important. Okay? Now you take those 3 lab values and you add on 2 other things. Ascites, right? It's a big word, but remember what it is. It's fluid in your abdomen. It's fluid in your abdomen, all right? And the 5th factor is what's called hepatic encephalopathy. All that means is confusion from the toxins that's building up from the liver. Okay? So you get a little foggy, you get confused. That's encephalopathy. All right? And then you take all these values, and there's a scoring system. All right? It's called Child-Pugh. Remember that. So you have A, B, C. Okay? A is mild disease, B is intermediate, and C is bad cirrhosis, decompensated, poor prognosis. All right, and it's a point system based on the 5 things that I mentioned. So these are very important things to know. There's other scoring systems out there, but I just want to leave you with that because I'm very familiar with this one. Okay, so all the drinking, hepatitis infection, and all these things eventually you will develop cirrhosis if everything is not treated. All right. So what you want to do is know these things to decrease the disease progression. You cannot reverse it. And you want to prevent the complications that come along with it. And that is the only way to improve the quality of life with cirrhosis. And if you have that diagnosis, you want to avoid any more toxins that's going to affect your liver, such as alcohol, right? Acetaminophen, right? Tylenol, okay? And try to maintain a balanced diet as possible. Make sure you have adequate protein, low sodium if possible, right? And again, your vaccinations. I know that is a very great topic these days, but when you have hepatitis A and B, it decreases your vaccinations for these things, it reduces your infection risk. All right? And again, regular monitoring. Because what can happen with cirrhosis is you get the varicose veins you get on your leg, you can get that in your esophagus, your food tube, right? And that can rupture and you can bleed. So it's important that you follow up with your docs, and the docs need to let the patients know. I see a lot of patients with end-stage cirrhosis that the docs have not had a good conversation with them in terms of these things, okay? First things first, try to prevent getting cirrhosis, okay? Try to prevent it by the amount of alcohol you consume, okay? The risk-taking behavior, right? So it decreases your chance of getting hepatitis. All these things are important. So I just wanted to touch on that today as a topic. So when you see your blood work, you will know what it means. Now remember, cirrhosis, I did not mention the ALT and the AST, which we call liver function test, because they're not part of the prognosis and the grading system for cirrhosis, right? So you could have a normal AST, ALT, but the 5 things I mentioned are off and you have cirrhosis. That's what it is. So just be able to not just order blood work, but understand it. And for the docs, I want you to take your time and explain it to the patient. Why are you getting these labs? You suspect cirrhosis, right? Are you going to get a biopsy? What are you going to tell the patient about this classification system if the albumin is less than 3? Or the INR is greater than 5, and the bilirubin is through the roof, okay? This is just my education for the morning. I'm Dr. Dangleben. Have a great day. Peace.